Joining me now from Toronto is CTV's infectious disease specialist, Dr. Abdu Sharkawy. Dr. Sharkawy, good morning. 313 new cases, certainly not the number we wanted to hear on this Monday in a week where kids are going back to school. Your take?
There's no question this is very sobering and really disturbing news. I think that many of us had anticipated that we would see a rise in cases that would coincide with reopening of schools. I didn't think any of us would have anticipated it would have happened this quickly. And quite frankly, we can't attribute these rises to opening of schools. This is an indication of what has been going on for several weeks now. A clear lack of awareness of the importance of all the public health measures which brought us success towards the end of April and May. We seem to have forgotten that. We've lost touch with those important, precautions that are needed. And unfortunately, I'm very concerned we're really well on our way. No Freudian intended there to a second wave.
Okay. Some people are going to be wondering, though, are we seeing this increase in cases because we're testing more people, doctor?
No, there's certainly some degree of increased surveillance that's happening and an improvement with respect to our testing capacity. But even when we account for that, we're seeing a disproportionate rise in the number of cases. We've seen that really since the end of May, to be quite honest. But over the past couple of weeks, the trend has been very significant. It's been notable throughout many parts of the GTA. And really what's most alarming of all is the fact that now we're seeing patients being readmitted to hospital with COVID-19 and ending up in our ICUs. That's a clear indication that the community signal has been really ramping up, and that's something that worries me a great deal.
So many of the cases, as we reported, are people under the age of 40. What sort of impact does that have on their health and on the healthcare system?
Well, there's two very important impacts that need to be identified here. The first is that even if younger people don't need to be hospitalized with this condition, they can have lasting and significant complications related to COVID-19. And there have been several documented examples of this. So not everybody who doesn't have to end up in an ICU is fine with respect to this. I want to highlight that. The other thing is that at some point, this critical reservoir of younger people will end up sharing this virus with the older, more immune-compromised segments of our society, and then we will be seeing more hospitalizations, more ICU admissions, and unfortunately more deaths related to this. And that's something we just want to avoid at any cost. So it can't be overstated as how important it is for everybody to band together here.
And it is worth noting that these cases are in this particular demographic. We're no longer talking about outbreaks in nursing home facilities or long-term care facilities. But I hear you on your point that these people could spread to our older population, our more vulnerable populations. What is your message to those people who are 40 and under and may think that they are immune or that this virus is not something that they need to take seriously?
Yeah, to be quite honest, I think it's a real challenge here. I think we all need to remember that we're doing this for everyone, including ourselves. No one is immune. And if we can do something that's going to help protect ourselves and protect our entire community, it's worth being accountable to everyone in our society. It's worth just remembering that if we do this right, we can get back to some sort of a semblance of normalcy. But if we are lax about it, if we're complacent about it, it really is something that's going to hit us all hard. It just can't be overstated. I hope we can reach younger people. I hope targeted messaging works. And the message is inclusive and hopefully not one that is, full of blame or judgment. But it can't be overstated just how important it is that we all tug on the same rope and pull in the same direction.
Dr. Sharkawy, thank you so much.